Yes. Good day, great students. You are welcome once again to this fourth week of e-facilitation for ANP506. My name is Dr. Abayomi Samuel Bankole, your course facilitator for ANP506. I'm sure you know me by now. Yes, because this is actually the fourth week and we have had a good journey thus far. Now, today we are going to be taking on an interesting topic. I want to look at specific or common diseases of livestock animals and their crosses. Yes, and their crosses. And we will be concentrating on the bacterial, viral, and parasitic diseases of these livestock animals. It's going to be an interesting time and welcome you on board once again. Yes, I welcome you on board once again, my people, my Greek students. Like I told you, the topic of today is common diseases of livestock animals in Nigeria and their crosses. We'll be looking at bacteria, viral, and parasitic diseases in particular. Of course, you know my name. I've just mentioned my name to you. Dr. Abayomi Samuel Bankole is the name. And my email is asbankole@noun.edu.ng. Yes, beautiful animals you can see right here. Yes, let's just go into the class straight away. Now, last week, we were able to deal with classification of livestock diseases and the strategic means of preventing, controlling, and eradicating these diseases. Now, in today's class, we'll be considering selected diseases of economic and zoonotic importance in livestock animals in Nigeria. And specifically, we'll be focusing on the etiology classification of livestock diseases, that is the causative organisms of these diseases. And that's one of the classification we had last week. You can remember other classification criteria we spoke about last week, but we are concentrating on the etiology classification of livestock diseases today. We have two major intended learning outcomes today. At the end of today's class, I will expect that you get familiar with common livestock diseases that can cause serious economic and zoonotic losses or zoonotic importance to farmers and of course to the public. And we also want you to recognize appropriate methods of preventing and controlling these diseases in the herd. Now, let's go straight to the heart of the matter. Like I told you, we'll be specifically dealing with bacterial, viral, and parasitic diseases. So we are starting with bacterial diseases. We'll mention a few of them. There are many. We'll just mention a few common ones, and then you can also read up the rest. Let's start with anthrax. Anthrax. I want to believe you must have heard about anthrax before. It's also called splenic fever. Splenic fever. Yes. Now, anthrax is a rapid and highly fatal infectious disease of cattle, sheep, goat, and horses that is caused by an aerobic gram-positive spore-forming bacteria called Bacillus anthracis. Yes, you remember this Bacillus anthracis. Last week we mentioned Bacillus anthracis. Can you tell me a man that attributed anthrax to Bacillus anthracis? Oh, you have forgotten. You have forgotten. You can't tell me. Let me tell you. The name of that man is Robert Koch in 1877. He was the one that attributed anthrax to Bacillus anthracis. Now, this anthrax has spores. They produce spores that can remain in the soil for a long period of even over 30 years, and they can become active when conditions becomes favorable. Now, this disease affects most mammals, including human beings. So it's very dangerous. Anthrax is very, very dangerous. Ruminants usually ingest this bacteria or the spores during grazing, or they can get contaminated through open wounds. Biting insects are also known to transfer this disease from one animal to another. The symptoms you see in anthrax include high fever, sudden staggering, difficult breathing, severe bloody diarrhea, bloody nasal discharge, and death within a few hours of contacting the disease. So it's very dangerous. Prevention of anthrax is by annual vaccination, especially in endemic areas. Now, this disease is a zoonotic disease, like I told you earlier, and because of its high fatal nature, postmortem is not recommended. That is, opening up the carcass after death is not recommended, because the spores can actually be very dangerous and they can affect every other person around, including animals and humans. Carcasses of animals suspected to have died from anthrax are usually buried in an enclosed area at the depth of 6 feet and covered with quicklime for complete destruction of the bacteria and its spores. Treatment is not recommended, of course. However, large doses of serum against anthrax could be quickly given, followed by high doses of antibiotics of choice, and that antibiotic of choice may be penicillin or erythromycin. This is just for prophylaxis. Let's go to number 2 bacterial diseases, and that is brucellosis. What did I call it? Yes, brucellosis. It's also known as Banks disease or contagious abortion. Yes, contagious abortion. Anytime you hear brucellosis, what comes to your mind should be abortion. Abortion, especially in cattle and of course in most livestock animals. Now, brucellosis can cause permanent sterility in bulls and cows, resulting in heavy economic loss. This disease is caused by Brucella abortus in cattle and man, Brucella melitensis in goats, Brucella ovis in sheep, Brucella suis in pigs, and Brucella canis in dogs. It is spread by bringing an infected animal into a herd, or by contact with aborted fetuses, or through contact with contaminated feed or water. It can also occur or spread by the sniffing habits or licking of aborted fetuses, or through cow from infected cow. Like I said, the symptoms include abortion, especially in the last stage of pregnancy. That's what we call third trimester. And you can find retained placenta, weak or dead calf at birth, and knee inflammation, which we call hygroma, in the animals affected. There is no treatment for brucellosis, Therefore, prevention is usually advocated. And this can only be attained by herd management. Let's go to number 3 bacterial disease, and that is bovine tuberculosis. Yes, TB, tuberculosis. Of course, bovine tuberculosis is a major zoonotic disease. Oh, maybe I didn't tell you what a zoonotic disease is. Let me tell you. Zoonotic disease is that disease that is shared between animals, that is vertebrate animals, and human beings. It can be transferred vice versa, either from man to human or from human to animals. So it can be shared between these two species of mammals. Now, let's go back to bovine tuberculosis. So we say tuberculosis is a major zoonotic disease that can be transmitted to man. Now, it's highly contagious and debilitating disease that is caused by Mycobacterium bovis and sometimes Mycobacterium tuberculosis. Symptoms are frequent coughing and emaciation. Now, this disease is mostly detected at slaughter during meat inspection. There is no treatment in animals. Therefore, these animals are eliminated, and all materials that comes in contact with affected animal are usually thoroughly disinfected. Number 4 bacterial disease is black quarter. This is an infectious disease of cattle and sheep that is characterized by emphysematous swelling in muscles. That is swelling within the muscle like a balloon, swelling in the muscles. And this is caused by anaerobic spore-forming bacteria known as Clostridium tubeae. And this disease normally affects calves. Bacterial spores commonly enter the body through the mouth and wounds, just like anthrax. Now, signs here include lameness, swollen muscles, I just mentioned that earlier, severe depression, high fever in early stages, and the affected animals may be unable to stand even. Sometimes one or more animals in the herd will just die suddenly. When you see all these signs, you can be suspecting black quarter. Now, treatment is achieved with massive antibiotics doses, which can provide effective recovery if done early or at early stage of the disease. Now, prevented mainly by vaccination and the proper disposal of dead animals by burning or burial. Yes. Number 5 bacterial disease is foot rot. This is an infectious disease of ruminants that is caused mostly by Diclobacter nodosus. It's also sometimes named Fusobacterium necrophorum. And this infection results in lameness, elevated temperature, loss of appetite, and weight loss. Injury to the interdigital skin provides source of entry for this particular infection. Now, this infection can be complicated by other opportunistic microorganisms such as fungi that is found in manure field and in muddy areas where ruminants are often kept, especially in feedlots. It can be prevented by good sanitation and good drainage of animals' environment. Also, effort should be made to ensure that manure does not accumulate around drinking and feeding point, because this can serve as easy source of foot rot infection. Now, foot rot treatment can be achieved by use of antibiotics such as penicillin and sulfur drugs. Sulfur drugs, yes. Number 6 bacterial disease today is contagious bovine pleuropneumonia. Of course, this is in cattle. You can also have contagious caprine pleuropneumonia in goats. Now, CBPP, as we call it, is a severe and highly infectious disease of cattle caused by Mycoplasma mycoides. Of course, like I told you, it is CCPP. Sorry, that's an error there. CCPP. In goats, is caused by Mycoplasma mycoides subspecies capri. Now, this disease is characterized by fever and it often affects the lungs. In cattle, CBPP signs include coughing, open mouth breathing, loss of appetite, rumination disorders, and weakness. In goats, this disease exhibits by showing labored breathing, and may even a goat may even bleat or grunt due to pain. They keep crying and grunting and all of that because of pain in the heart and difficult breathing. So now, this disease is prevented majorly by vaccination and culling of infected or carrier animals following serological tests. Treatment is often by antibiotic use, such as that of tylosin, and which is effective at taking care of the disease in goats. Number 7 bacterial disease today is dermatophilosis. Dermatophilosis. Oh, you know the other name that this is called commonly in the Hausa tongue. Krichi, that's what it's called. Yes, Krichi is the other name in Nigeria. It's commonly called in Nigeria. Krichi. And it's a contagious skin disease of ruminants, especially cattle. Now, this skin disease often affect horses and humans as well, and is caused by Dermatophilus congolensis. Dermatophilus congolensis. It is characterized by crusted plaques on the skin for affected animals, as well as weight loss and drop in milk yield. I know some of you that must have had opportunity to work on a farm. You would have seen dermatophilosis before. It's quite common around. So now this condition is common especially during the rainy season. Yes. Now there are predisposing conditions to this bacterial disease, and they include injury to skin and presence of ticks and biting flies. Yes, on the skin. Treatment is by use of appropriate antibiotics. Yes, let us go to viral diseases now. Viral diseases, we will just mention 2 or 3, and then we'll go to parasitic. We are done for today. So let's start with number 1 under viral disease, and that is rinderpest. Rinderpest. Now, this is a contagious viral disease of cattle, buffalo, sheep, and goats, and is characterized by fever, oral erosions, serous to mucopurulent nasal and ocular discharges, diarrhea, and high mortality. This disease is caused by a morbillivirus of the Paramyxoviridae family. It occurs often as an epidemic, and is transmitted by close contact between infected and non-infected animals through inhalation or ingestion of contaminated feed, water, and nasal discharges. This virus is normally present in blood, tissues, secretions, and excretions of an infected animal, so it is easily transmissible. That's what it means. Now, treatment is not usually recommended in rinderpest. Prevention and control strategies include quarantine, slaughter of infected animals, and proper disposal of carcasses, followed by disinfection of the entire environment to avoid spread to other animals. Number 2 viral disease today is foot and mouth disease. Foot and mouth disease is called FMD. FMD is a severe, highly contagious viral disease of cattle, sheep, goats, buffaloes, and pigs, and is caused by virus with 7 serotypes. We'll stop at that. Now, of course, the virus generally is called FMD virus. FMD virus. Now, signs you see in animals with foot-and-mouth disease include fever, vesicle formation on the teeth, tongue, lameness. You see weight loss. You also see excessive salivation. Now, the spread of this disease is by contact between infected and non-infected animals. It can also occur by fomites. Of course, that's by fomite, by inanimate objects that have had contact with infected animals. It can also occur by inhalation. As infected animals carry large amount of aerosol virus in their exhaled air. Now, there is no definitive treatment for FMD, and the infected animals are usually recommended for culling after recovery. This disease is controlled by vaccination mainly. However, the vaccines used must protect animals against the serotypes causing disease in a specific area. Number 3 viral disease today is Pesticides de Prete ruminants. PPR, it is called. PPR is a fast-spreading severe viral disease of sheep and goats that is caused by morbillivirus of the Paramyxoviridae family, and it is characterized by high fever, weakness, oral lesions, cough, foul-smelling diarrhea, discharges from the eyes and nose with difficult breathing. PPR is transmitted mostly by aerosol, and all secretions and excretions from sick animals contain the virus. There is no specific treatment for PPR, and complications can come by bacteria and parasites, which can easily be treated to minimize or reduce mortality. Now, prevention is mainly achieved by use of vaccines, appropriate vaccines. Now, let us go to parasitic disease. This is where we'll be stopping today after we finish with the parasitic disease. We will concentrate mostly today on blood parasites. There are digestive system parasites. There are ectoparasites. There are a lot of types of parasites. Well, because of limited time today, we'll concentrate on blood parasites. And of course, we are starting with protozoan diseases. Protozoan disease is a type of parasitic or blood parasite transmitted by vectors. insects vectors. So we are starting number one under protozoan disease now. We are looking at trypanosomosis. Trypanosomosis. Yes, it used to be called trypanosomiasis. Yes, but current nomenclature says it is trypanosomosis. Now, this is a severe parasitic disease that affects cattle, sheep, and goats, as well as camels, antelopes, dogs, and humans. And this disease is caused by different species of trypanosomes, which are transmitted by biting flies, especially tsetse fly or Glossina species. Now, the species that cause disease include Trypanosoma brucei in cattle, sheep, goats, and camels, while you find T. evansii causing disease in cattle, goats, and camels. You find T. congolense causing disease in cattle, sheep, goats, and camels. You also find T. vivax causing disease in cattle, sheep, goats, and camels as well. And then you find T. simiae causing disease in sheep, goats, and camels, and T. melophagium causing infection in sheep and goats. Now, trypanosomosis is characterized by intermittent fever, anemia, condition loss, and death. Now, this disease can occur in three specific forms. One, acute, subacute, or chronic form. Now, diagnosis is usually based on trypanosomes demonstration in blood smears. However, more specific tests for diagnosis include enzyme-linked immunospecific assay or indirect fluorescent antibody test. Treatment of trypanosomosis is usually achieved by use of trypanocidal drugs such as diminacin acetate or omodium bromide. These are the common ones. There are other ones available in the market. Now, vector control remains the most effective prevention means of debarring the spread of trypanosomosis. Number two protozoan disease we will be looking at today is babesiosis. Babesiosis. It's also called pyroplasmosis, red water, or tick fever, or you usually hear tick fever. That's very common in Nigeria. Now, tick-borne, this is a tick-borne disease of ruminants that is characterized by fever, anemia, hemoglobinuria, that is reddish dark brown urine. Once you see that reddish dark brown urine, then you know that you have a serious babesiosis at hand. And of course, you see weakness in animals. Babesiosis is caused in cattle by Babesia bigemina and Babesia bovis, which are often transmitted by ticks of the species Buphalus. However, in sheep and goats, this disease is caused by Babesia ovis and B. mutasis, and it is transmitted by ticks of the genus Haemaphysalis and Rhipicephalus. Now, diagnosis here is usually based on demonstration Babesia parasite in blood smears. The control is by proper tick control and quarantine. Animals should be routinely treated with caricides, and we also have tick vaccines that are available these days for use. Let's go to number 3 protozoan disease today, and that is coccidiosis. Yes, coccidiosis. Coccidiosis is a very severe disease affecting mainly young animals, such as cows, lambs, and kids, and it causes serious economic loss. In sheep and goats, this disease is caused by Himeria species, such as Himeria parva, Himeria longi, so on and so forth. And it is characterized by bloody or mucoid diarrhea. You can also see anorexia, tenesmus, that is straining, just straining, and weight loss. Diagnosis is based on history, clinical and necropsy findings, and the microscopic examination of feces. Treatment is by use of coccidiostats, and all animals in the herd are often treated together because this disease can easily spread. Now, the prevention measures include good hygienic practices such as removal of animal manure, avoiding overcrowding of animals, and pasture management to control the parasites. Number 4 protozoan disease today is theileriosis. Yes, theileriosis is also called East Coast fever. Now, this is an hemoparasitic disease of cattle. Oh, you want to know what hemoparasitic means? Blood parasites. That's what I said. So we are dealing with blood parasite. So it's an hemoparasitic disease of cattle, sheep, and goats caused by theileria, and it is transmitted by ticks. In cattle, this disease is caused by Theileria parva, T. mutans, T. mellifera, T. turotragi. While in sheep and goats, the causative parasites include Theileria ovis and Theileria isai. Now, tick vectors involved include Cephalus appendiculatus and the Amblyoma variegatum, as well as Hemaphysalis species of ticks. They are involved in the transmission of this microorganism called Theileria. Affected animals usually show signs of anorexia, decreased milk production. They also lose condition. There is usually rumination cessation, and there is rapid heartbeat. You can also find petechial hemorrhages under the tongue and in the vulva. Now, diagnosis is by the demonstration of the parasites in blood and schizons in lymphocytes. It's quite specific. Now, disease is controlled by good hygiene and use of appropriate drugs for treatment. Now, let us go to rickettsia disease. It's also blood parasites, but they are called rickettsia disease. Number 1 here is anaplasmosis. Anaplasmosis is an infectious disease of cattle, sheep, and goats caused by intraerythrocytic parasites of the genus Anaplasma. And of course, signs you see in anaplasmosis infected animal include fever, depression, progressive anemia, inappetence, that is loss of appetite, labor bleeding, jaundice, constipation, abortion, and death. Now, in cattle, this disease is caused by Anaplasma marginale, and it is transmitted by ticks of the Dermacentor species. It is also caused by Anaplasma bovis, and this is carried by the Haloma species of ticks. The control of anaplasmosis is by keeping tick vectors off the animals. That's vector control. And you can also use vaccination to prevent the disease from occurring in the heart. Number 2 rickettsial disease today is heart water. Now, this is a non-contagious infectious disease of cattle, sheep, and goats, thought to be previously caused by a rickettsia, but now a bacterium, Ehrlichia ruminantum, formerly called Caldria ruminantum. Now, it is transmitted by the ticks of the genus Amblyomma variegatum, and symptoms you see include chewing movements, tongue protrusion, highly twisting, and suckling. Now, neurologic signs becomes apparent as the disease progresses, and animals can go into a state of convulsion and lateral recumbency with paddling movements, twisting of the neck, that's what we call opisthoturnus, tonus, and mouth frothing, fluid floating from the mouth. That's what we mean there. Now, prevention is by tick control and vaccination. Now, what have we learned thus far today? In summary, we have been able to examine the common economic and zoonotic livestock diseases in Nigeria based on causative organism, that's the etiology. That is, we're able to look at bacterial, viral, and parasitic diseases. And we also considered the major means of prevention and control of these diseases. Now, this is where we'll be stopping today, but please ensure you always engage in the class activity. Please visit the virtual learning environment constantly, and I'm sure you are finding this e-facilitation quite interesting. Yes, it's getting interesting because we are going into it systematically. Till we meet next time, from me to you, I say bye-bye. Bye-bye.